Dr. Bhalerao. This is Sumaya. Sumaya is
Yes,
a fitness trainer. She has also studied
yes,
sports science, and she's the
yes.
founder of Sumaya. And this is Dr. Bhalerao. He is the consultant cardiothoracic and transplant surgeon at the Wockhardt Hospital in Mumbai. Thank you both very much for joining me today on a very crucial issue. Over the last some weeks, maybe months, we've been noticing an upsurge in incidence of heart attacks in the young Indian, especially because these are people who are in the news, whether it is actor Siddharth Shukla or the recent death of Puneet Rajkumar. Before that, also, we've been hearing many other cases. These are, of course, the people that we know about. There are many that are not written about. There are many who we've heard. We've got anecdotal evidence about it as well, especially during COVID. So I'm going to just quickly kick off this conversation because I know there's a World Cup final coming up after this. So we need to let everybody go. I'll start with you, Dr. Bhalerao. It's a bit of an irony, isn't it, that when we're talking about these people, these young people under the age of 50 who are passing away, we're actually, it's like a postscript. There's always a line saying people who seem fit, people, who are physically fit have passed away. Isn't that
Yes,
a dichotomy in itself?
yes, it is because people who are perceived physically fit may or may not have some sort of a cardiovascular risk factor. They might be smoker, they might have familial diabetes, their eating habits might not be there. So that perception that fit people would not have a heart disease no longer holds true. With the current amount of stress that we are withstanding, especially in the COVID times where the lifestyle has gone on a roller coaster ride, we see 50% of patients with heart disease who are less than 50-year-old, and we see at least 25% of the patient between the age of 25 to 35. So, young onset heart disease is very common with us, which is often neglected. People have symptoms, people have some sort of the risk factors, but we are not paying attention to it because we are in a rush of achieving something else in life. And that is when we, it is as they say, life strikes you when you're not prepared for it. So these people who are seemingly fit definitely have some sort of physical risk factor, some sort of behavioral risk factor, and they have got into some sort of a training or what we call as excessive training and have landed up into some these kind of problems. So looking fit does not mean that you are healthy by heart. The parameters and the evaluations are entirely different, and you can still have a heart attack even if you are doing your exercise regularly.
So, Sumaya, that brings me to you. It's your profession that is under some sort of an attack right now, isn't it? That because we are also looking for scapegoats, and because say in the incident of Puneet Rajkumar, the news filtered out that he had just finished exercising. So it's also very easy to just say, don't run so much or don't do so much fitness, and just generalize it. Is that something that you're coming across?
So of course the ones in the deaths, the untimely deaths that have been in the limelight are the ones that we hear about, but I personally have had about 3 acquaintances and friends who've been under 50, super fit, who've actually all coincidentally died either just during exercise or right after exercise, which has been quite recent. So I've had actually 3 very close male friends who were extreme athletes, or recreational exercisers who've just lost their lives in the last 1 year. So I think what really is happening is about 2-3 things. I think COVID, of course, was such an unknown. It was an unknown disease for us. What's happening after COVID to the body, how our bodies are reacting. But the one, and and the timeline of how long the after effects are staying. So, for example, you could have had a mild attack of COVID, and like this friend of mine who I lost, a very, very dear friend of mine who was extremely fit. In fact, he trained with me about 2-3 years ago, but currently he was on his own fitness regime, super young, 43 years old, left with his wife and 2 kids, and died really like literally while he was running. And he had COVID about 3 months ago, which was last year sometime. And his COVID was very mild, and all his parameters were fine. And that time, COVID is very unknown. And he died 3 months later. So, of course, everybody pinned his death on COVID. Similarly, somebody else who passed away. But there have been certain deaths which have been, yes, post-COVID, but also very long after COVID. And that actually takes me back to 2-3 things. One, like Doc said, your appearance doesn't justify you being physically fit. There's something called people who are thin can be skinny fat. So they have high body composition of fat, but they're skinny. So just because they look thin doesn't mean they're actually fit. And similarly, people who look slightly heavier doesn't mean that they're always unwell. So the heart is, and of course, doctor, please correct me whenever you want to. With the heart, I think ECG is not the only parameter of how healthy your heart is. Especially with the occurrence of the post-40 and, men and women setting these goals now, fitness goals post-40. Okay, I'm turning 40, I want to run a marathon. I'm turning 40, I want to do a Ironman. I'm turning 40, I need to start a fitness regime, because people are seeing how fit people are in the West. And 40 is no longer how we perceive 40 to be. I'm 43 and 40 is young. So all of a sudden, people who haven't exercised in the past have taken on to new exercise programs, and they've set themselves these maybe unrealistic goals relative to them. So because as a non-exerciser, if you say, okay, I want to run a 21K within less than 45 days, now that relative to you is high intensity, right? It's high volume training. But again, somebody who's conditioned to exercising for many years, in case of Puneet, and with him, maybe what he was currently doing, his lifestyle, his risk of cardiovascular disease could just be thickening of the heart muscles, which he hadn't got tested. It could be, I think it's called cardiomyopathy, Doc, am I right?
Yes.
Where your heart muscles thicken, and that basically restrict the blood flow. So maybe your ECG could be fine, but this is, or you could have a genetic arrhythmia, which you're not unknown about. So there are varying degrees of what happens in the heart. So why I'm going so long is because I'm trying to answer your question as informatively as possible, because I don't want to deter people from exercising. There's a very fine line. I think what we need to really look into is, number one, if you start a fitness program, it needs to be progressive. It needs to start with where you are currently at your fitness levels, and then you need to work with someone who can slowly build it up. If you're in your 40s, especially male 40s, you want to, whether you've been exercising or not, you want to be regular with your heart tests, which doesn't mean just ECG. It could be a CT angiograph. Doc, please correct me if I'm wrong. And if you would like to add. And like with women, we say post 35, you must do your mammogram, whether you have whether you have breast cancer in your family or not. It's just something that we need to do. And seeing that cardiovascular risks are higher in men than in women, because women get saved because of their hormones. Men don't. And of course, women also get risk to heart disease when you menopause. But, we are slightly safer. I'm sure it's happening to women as well, but we are slightly protected with our hormones. With men, they're more exposed. So, of course, a heart test to work within limits, to understand your body. When you're tired, that is your cue. So, we fitness trainers keep saying, we try to motivate you and say, okay, even if you don't feel like it, just show up. Sometimes your body is actually giving you signals to say, really don't show up. It's okay if you rest. And I've seen a lot of people who are training heavily. They don't realize that heavy training is very relative. For you, heavy training could just be 2 kilometers because you're not used to running 2 kilometers. For me, heavy training could be 4 days back to back of HIIT, not breaking it with a rest day. For Doc, it could be that he's just all of a sudden expose himself to a first HIIT workout where he's never let his heart rate fluctuate between the 180s and all of a sudden dropping to the 120s, because that's what HIIT is all about. So it's very, very unique to each person. But what is generic is that to be careful and listen to your body. Number two, when you are embarking upon an exercise program, you don't realize when you're exposing yourself, your cortisol levels are on a high. Cortisol is stress. And most people who train really heavy don't sleep well. And that is the reason why that is because when you train very heavy, you also raise your cortisol levels, because heavy exercises puts your body under stress, and stress means cortisol. It's really like mimicking stress in your life, but this is physical stress. So we as trainers are now saying that, listen, you're exercising, but you need 2 rest days in a week where you do complete rest, or you do active rest of a long walk. So the reason all of this is happening is because there are a lot of fine lines. There's a fine line of motivating yourself and not pushing yourself. First thing is that you can't just dive into an exercise program and be at, if you want to say, be at ladder number 10 and you are standing at 0. You can't go from 0 to 10 in 30 days. The body takes time to adapt physically to a routine, and the only way you need to be consistent. So don't think of it as a short-term goal. If you want to start running a marathon, if you want to go into a training, give yourself at least a good 6 to 8 months to train. Let your body adapt under that stress. Let your body understand that environment, because exercise is stress for the body.
Doctor, I can get you back in.
First of your question is, has COVID increased the possibility of having a young people with heart attack? Definitely it has. Especially patients who have been affected because of cardiac problems during the COVID times. We have seen that in what we call as a long COVID, they came back with some sort of exertional angina, some sort of decrease in their heart function in next 3 to 6 months after COVID. People who had asymptomatic, just did not have any signs of COVID, had also come back with some sort of a heart element, shortness of breath because of decrease in heart function, what we call as cardiomyopathy, or a stress-induced cardiomyopathy because of COVID. Now, second question which you were referring to is about excessive training and sort of what we call as compulsive athletes. So we need to look at what is the exact duration of exercise and what is the nature of exercise that someone's body can adapt itself in a healthy manner. So what the regulatory body, what we call as CDC, has advised that probably around 150 minutes of moderate exercise per week, which totally amounts to around 20 to 25 minutes per day, is for a beginner, is adequate and healthy. For someone who wishes to start with a strenuous exercise regime to begin with, after he completes probably 3 months of some sort of 20 to 25 minutes of either moderate aerobic exercise, which he can go on to strenuous, to be probably around double or triple of that. We need to look at that more. It doesn't mean that more you exercise, you're going to become healthy more. The beneficial effects of having doing exercise, whatever the amount of whatever nature of exercise you're doing, actually starts going down when you incrementally increase the amount of exercise more than 4 to 5 times. Okay, so whatever duration I told you, that's if we take that as a minimum duration, that's what minimum is advised for to have a healthy heart or healthy body. If you go on to have more than 4 or 5 times, the benefits of exercise starts going down. And if you're doing probably 8 to 10 times what is advisable, you will end up seeing something what we commonly see now is exercise addiction, or we see obligatory athletes who are running for 25 kilometers and coming with different health problems, which we can discuss. We would advise everyone to have moderate regular exercise to maintain their, to get their blood pressure down, in the patients with diabetes to have better control, for their mental well-being, for physical well-being. It gives so many benefits, but as Sumaya said, it's a very thin line. Where do you overdo it? The moment you start overdoing it, you'll end up getting into problems.
So I'm just asking a question on behalf of people who've had COVID. For some, the recovery has been really long. They've been tired for a long time. So everybody at the end of the day then feels, doc, that they should get back to business, try and become a little bit fit. But it could become counterproductive, right? Because how do you know? Even if you're in the beginning, a lot of doctors were saying you shouldn't even be taking a walk if you've had COVID, especially long COVID, and just take it easy. But how do you know when it is the right time for your body to go back to exercising?
So we evaluate them by whatever there is a lung functions. Okay, so if someone had a COVID and had a serious lung affection, by X-ray and pulmonary function test, we come to know how much is the improvement occurred, whether there is a residual lung fibrosis, because these patients are not going to be normal for probably 1 to 2 years. Okay, if they had asymptomatic COVID and didn't have any lung issues with that, probably it takes 3 to 6 weeks for a complete resolution of the parenchymal changes if you are not, if it was an asymptomatic COVID disease. So they need to see their chest physician and a cardiologist to make sure that they're all right after 3 months of their COVID disease is over. And once they give them a clearance, they should start sort of a moderate aerobic exercise, 10 to 15 minutes twice a day, and then slowly go up to level to make sure that they are not overdoing it and are not becoming symptomatic. They're not becoming dizzy, they're not becoming short of breath, they're not having chest pain. So all these things, it's difficult to answer in one question, because everyone's scenario is going to be different. Everyone had a different grade of the disease. But overall, they need to have a repeated health checkup, probably every 3 monthly for a period of a year, to make sure that their physician and cardiologist give them a correct advice. When do they start? How do they increase? And how do they get back to their previous physical activity that they were doing?
Sumaya, you earlier spoke about 2 to 3 incidents that have happened around you of people who've succumbed to a heart attack. How do you then get up and go and train more people, especially, you know, if you've had like a good personal relationship as an instructor with them?
I think COVID has taught us a lot. There's a lot of science that has, of course, it's still unknown, but there's now, because we've all suffered COVID for over 2 years, there's some amount of research that is now backed. So like Doc said, there are certain protocols in place by even the American Council of Exercise, the American College of Sports Medicine, who have taken out guidelines of how to restart a program post-COVID, which basically is very, you know, it's pretty standardized that 6 weeks post-COVID, if you've had long COVID or if you've had COVID, which has affected your lungs, you need to go back and get your tests done again, see your lung function, see your cardiac health, and come back into an exercise environment. And the safest exercise environment to get back to would be walking. Wearing a heart rate monitor would be we all have smartwatches. It's important to keep those on. So wearing a heart rate monitor and starting with the walk and testing how not just how perceived exercise is, how your heart is perceiving the stress of exercise. So your heart rate will tell you that, you know, earlier, if you were walking at a certain speed and your heart rate was 120 and all of a sudden now it's in the 140. So you already know your heart, you know, it's a stressful environment for your body. But not just seeing how fast your heart rate is climbing, but also seeing how soon it's coming back to its resting heart rate. That is actually cardiac health. You know, how it's rising and how soon it's coming back. And that's actually how athletes, how athletes, I'm looking sorry for a loss of words, how they monitor their cardiac health, of how soon they get back to as close as possible to the resting heart rate. So walking is a good way of exercising, going back to starting with just basic stretches. So even if you're walking, if you're stretching, it's good exercise, you know. And of course, watch your food. If you put on some weight and weight is your concern, then weight loss happens in the kitchen. So you don't have to over exercise. And slowly when you're looking at your, you know, when you start looking at your watch and you're feeling comfortable with how your heart rate is progressing, how it's coming back, that's when you go into an exercise environment where you go into a steady state, where you start doing a steady state workout, where you're either doing weight training or you're doing a steady state, slow walk, slow jog, and constantly watching your heart rate monitor, because that's the best way to tell, of course, after your prerequisite test. And slowly, you will start feeling it. And after your tests are done, 6-7 months into it, maybe it's a good idea to really expose yourself after all your tests are done into a slight HIIT kind of a workout. So the intensity which everybody's talking about, you know, I've seen this a lot in the news where everybody's saying, oh, everybody's doing HIIT. They're doing high intensity exercise. Now, high intensity doesn't mean, high intensity means, high intensity could mean you running from 0 to 2 kilometers if you've never done it. But actually, HIIT means high intensity interval training is a type of exercise which includes Tabata, etc., where the program is designed to have heart rate fluctuations. That is the way the program is designed. It's supposed to have these peaks and troughs in the workout. But if you follow a steady state workout or a steady state, even just a weight training workout, which is not fluctuating your heart rate as much, it should be safe. But again, I would say, sorry to interrupt, last thing I would want to say, I'm also actually seeing that a lot of people who are succumbing to some kind of cardiovascular issue are not just people who've had COVID. They've actually people who've not had COVID. Now that is actually the surprising one. COVID, you can still say, okay, theek hai, COVID ho gaya. But the ones that are worrisome are the ones that no COVID, in their 40s, have been exercising for the last 10 years, are reasonably eating well, are doing everything by the book right. So what just happened to that person? That is the answer that someone like me is also looking for. Is it that, is it stress? Is it not sleeping enough? Is it, why is that happening? And that's what I want to ask Doc to answer. I want to ask Doc that why is that happening?
Yeah.
That's
where we originally began with.
So as you were referring to high intensity exercise thing, so we had a number of patients who had everything normal. They had their cholesterol in check, blood pressure in check, and still suffered heart attacks in their late 30s or early 40s. There have been a lot of studies in this. Why does it happen? Okay, so chronic extreme exercises actually leads to heart damage in a longer run. How does that happen is, it sort of remodels our ventricle. Ventricle is the pumping chamber of the heart. We don't realize that it is happening. It does happen, okay? And there are some sort of a protein, like what they have said is galactine-3, which is generated, which increases the fibrosis in the heart. So as I was referring to my first answer, is you will have an optimum result of exercise probably if you do it 4 times what is advisable. But if someone is doing a 3-hour or 4-hour or 5 hours exercise, he would not notice it. But a chronic irreversible ventricular remodeling will keep happening, and that leads to fibrosis. Fibrosis is when a good muscle is replaced by not so good tissue. Okay. Second thing, what happens is the myocardium, that the heart chamber, starts becoming thick. Okay. And these changes are often difficult to get picked up initially because we don't do cardiac MRIs of all these patients who are looking healthy to us. And when they subject themselves to some sort of an extreme exercise training, they'll end up into getting arrhythmias. Arrhythmias is when the heartbeats become they increase in number. So something like an atrial fibrillation, which goes into a ventricular fibrillation, and they get into cardiac arrest. Maybe that such things had happened with people who are extremely athletic and marathon runners who just collapse on the street at the end of the marathon. So to answer your question, we don't have all answers, but there have been a lot of studies on chronic extreme exercise training, which had led to a significant amount of muscular damage that happens to the heart if you are training it for too much longer duration, by causing arrhythmias, by causing myocardial fibrosis, and by causing irreversible ventricular changes that often affect these people. Second thing which happens, which is surprising, is as you know, the process of atherosclerosis in a smoker or a diabetic occurs, and the coronary arteries develop chronic calcification and patients develop block. You would say this phenomena is very common in patients who are unhealthy, didn't have a good eating habits. But similar thing happens in people who have chronic extreme exercise testing. So they had tested marathon athletes who have been running for last 20 years, around 4 to 5 hours a day, and their coronary artery calcium scores are as comparable as someone who is diabetic who had unhealthy eating habits. So coronary artery calcification is more common in people who have chronic extreme exercise or what you call as overtraining syndrome. And we do not know when the plaque ruptures. When the coronary arteries have plaques in that, a smallest stress, a little bit of overstretching or pushing or pulling, and a little bit increase in heart rate, blood pressure, any sort of a stressor would lead to a rupture in the stable plaque in the coronary artery, and you'll land up into a myocardial infarction. So this is what is the overall pathophysiology, is why do heart attacks happen in younger, seemingly fit people, because you have to look at not the duration, intensity, and also the overall basic physical health of the person to decide whether he was overtraining, whether it is excessive training, whether this is high intensity or a moderate intensity exercise for that people. What I often see in my people who come with sort of an exercise addiction to us is that it's a constant desire to prove yourself that I can do this, I can achieve this goal, I can run for 15 kilometers, someone can cycle for 100 kilometers. And at the end of the day, they don't realize that they are actually having adverse effect on the heart, which they will come to know probably down the lane after 3, 4, 5, 6 years. This is the sort of thing which is happening.
I would actually like to add one point when Doc is talking about overtraining. Overtraining has a lot of external parameters which justify that you're overtraining. It doesn't mean it's not just the duration of, say, 4 or 5 hours that you're overtraining. Overtraining could mean any exercise or any physical activity which is beyond 45 to 60 minutes, and where you're exposing yourself to a stress environment, which is exercise, and it could be any form of exercise, and especially seen in these recreational marathon runners, you know, the ones who are setting their post-40 goals. I want to do an Ironman, I want to do that. Now, typically, if you look at an athlete in general, they eat like an athlete, they sleep like an athlete, they're very disciplined. Now, someone who is training for a marathon or who is exposing themselves in a stressful environment and who is now leading the urban life, which is stress of work, stress of partying, stress of late eating, late sleeping, not well rested enough. So as it is the hours of exercise that you're doing, because anyone who's training for a marathon would be doing more than about 75 to 90 minutes of training a day, or 3 times a week, including some form of strength training. Now, when you're doing that volume of training, your body demands rest. Your body demands rest, not just physically, but also mentally. So with already high cortisol and nutrition, so with already high cortisol in your body, you are now not sleeping well. You are probably stressed with work, and you're not as disciplined as an athlete. So even just this as an environment is overtraining. Overtraining just doesn't mean कि आपको 5 घंटे तक train करना है तो आप overtraining कर रहे हो. Overtraining उस factor में आ जाता है कि आप now you are not resting, you're not sleeping, you're not fueling your body well, and you're not respecting the body to give you that kind of physical activity. So a lot of people who are on the streets taking to these 100-kilometer cycling, and there's so many cycling clubs. One of my friends I lost while he was cycling. One friend of mine I lost while he was running. And these are people I have known personally who have been super fit, who have been consistent exercisers. And I can say that, yes, today after hearing Doc, you know, sometimes we put that pressure of outbeating ourselves. कि लास्ट ईयर मैंने इतना किया था, अब मैं ऐसे करूंगी, मेरा टाइमिंग ये था, अब मैं उस टाइमिंग को बीट करना चाहती हूँ. You know, I want to shave off that kind of timing. To even shave off a minute in a marathon requires hours and hours of different kind of training to shave that 1 minute off, and that is a lot of stress for your body. So I think somewhere all of that is also playing a role, apart from obviously the physiological changes that are happening in the body post 40. No one can deny that physiologically, internally, your body is aging. That is science. And the speed of how physiologically your body is aging totally depends. We can't see what's happening inside the body. You're not constantly going into a CT scan and saying, now I want to do a full body CT scan every year. You know?
No,
so I think that we need to respect the physiological changes that are happening in the body. We need to respect if we are as a family predisposed to heart conditions. So there are a lot of parameters for a topic like this to really decide whether overtraining हो रही है, कि exercise क्यों हो रहा है, कि heart attack क्यों हो रहा है, you know, because it's such a, even Doc will say, it's so unique and it's so wide, you know, it's with each case.
Yeah.
So we can't generalize it.
It's different for different individuals at this, because we all have a different genetic makeup. We all have a different predisposing factors for heart diseases. So something which is high intensity for someone might not be high intensity for someone else. Exactly. So the goals have to be pretty individualistic, and you cannot generalize. No trainer or a doctor can generalize whether this is good enough for someone or this is not good enough for someone.
So is there
someone who is good,
Sorry, because,
I think
as Sumaya was saying that 40 is a big turning point. So there was a question saying, what is a good exercise regime
I think
for somebody in the 40s? Is there a way to bring that out?
I think the first thing that with the experience of what we've all been through in the last 2 years, and with these sudden cases and rise in people having cardiac issues post 40, considering the 40-year-old is getting fitter, so why is it happening? I think the biggest learning is, number one, to pre-test, is to make sure you're doing
Yes.
preventive testing. I think that
Yes.
is really most important. People I know in my profession, when we do an evaluation, I'd ask them, okay, so when was the last time you did a blood test? Or when was the last time you did a TMT? People don't do that unless they have to do it for insurance purposes. कोई TMT
Yes.
करता ही नहीं है. So I think preventive testing for some. So I think that is one take, that every year make sure you do your preventive testing, your blood test. If you're somebody who's physically exposing yourself, do a CT angiograph. I think it's a good test to do. It gives you doc, please correct me if I'm wrong. It does give you a lot more insight than to an ECG. Do your TMT, do your blood test, and doc can tell us any more tests that we can do.
So
And then of course train with a trainer who understands your activity,
and who is trained himself.
Yes.
But everyone needs to decide what kind of exercise they want to do. If someone wants to do a moderate kind of exercise, just a physician evaluation with a stress test is enough for to go ahead. But someone wants to train himself for weightlifting, high intensity exercise,
Right.
go for competition. These people need a complete health evaluation, and they need to give goals progressively so that they don't.
Oh, no. Not now.
The session was going so well because this is
to be done yearly. So
Yeah.
now we advise. So above 35, everyone should have a preventive checkup before they start off an exercise regime. If they're regular also on exercise regime, every yearly, or after 40 we generally say every yearly, but between 30 to 40 we say every alternate year, they should see a cardiologist, make sure everything is fine, and make sure that they get trained at a place and with help of someone who knows what kind of a training they are being offered.
So, Doc, I have a question for you, and I'd asked Sumaya this question a little bit earlier about the number of feet of supplements that are in the market today. The kind of supplements that a lot of, as I was also mentioning, the untrained trainers, the trainers, who have a gym in the mall or, one on the street here, that they're encouraging their clients to take. How damaging is that?
Now, these supplements are actually maybe vitamins, mineral, amino acids, enzymes, botanical products. Sometimes they're Ayurvedic products, glandular extracts. A lot of them are there available on the shelf. Now, we do not have a standardization about their quality. We do not have a standardization about their content because they don't come under so-called drugs or FDA approval thing. These are supplements. So no one checks the quality control things are not as strict for them as for any other drugs that we take for diseases are. We tend to neglect a lot of side effects of these supplements for a longer runs. If someone who is on a very high protein supplements, most of them are adulterated with little bit of steroids so that the muscle mass is falsely shown that it is increasing, and the person who is using it gets a false perception that it is actually muscle mass, but it is not. So long-term use of supplements is not advisable. Okay. People still use it for the peer pressure or for the fanciness of it, but having a good protein content, probably 40 to 60 grams for an adult male, adult female, and 50 to 70 grams through a natural is something that is advisable. If you really want to take supplement, please talk to a dietitian. Please talk to your physician whether this supplement is good. Look at the content, talk to them whether I need this content, that's one thing. And if I need them, whether they are in correct quantity and whether the supplement that I'm taking is the real one. Because there are a lot of heavy metal products which are adulterated in this, where people come with kidney damages, excess creatinine coming with renal failure, some sort of toxic metals which are never tested. And most commonly we see is overuse of steroids just to have an effect, which is as early as possible, and these people land it into avascular necrosis of hip or long-term effect as an osteoporotic spine after 4 or 5 years, and significant sodium water retention in these patients. So I'm not saying no to supplements because we do not know what supplement they want to use. If preferably avoid them if you can. If you cannot, just take them with someone else's help and guidance, that they know what you have been prescribed, what kind of exercise regime that you're following. Blank over-the-counter use of supplements should be banned as early as possible, because that not only is a wastage of money, but it is a health hazard to so many people.
So Maya, we can continue with this conversation, but I think I've got to quickly wrap it up. And I have a final question for you. You were mentioning the recreational fitness and the HIIT and the whole, the bug, as I call it, actually. I have also found that in that urgency to look fit, forget the supplements for a minute here, the urgency to look fit, to look good, to be part of that peer pressure, which is now coming to the 40s and the 50s. The point that we tend to neglect is that a good diet works equally brilliantly on the side. The amount of focus that we're just doing on the exercising, we're tending to forget that, it is in equal parts, both the things.
So I think I'd like to first start saying that exercise is not a punishment in lieu of a bad diet. I think that's how people say that I'll eat badly, but I'll go and exercise in the gym.
Yes.
And I've always said that it's both nutrition and exercise. Nutrition more than exercise when it comes to seeing aesthetic changes in the body. So when you want to work towards a six-pack or you want to work towards looking lean, it's actually more, I say abs are made in the kitchen. It's more of how you're eating and then you're exercising. So I often say that if aesthetics is the key, that you need to eat smart and you need to train smart. You need to stress your body lesser to actually get that, that body. It's a myth that you need to, and this 1 hour that we put that, you need to exercise 1 hour a day. It's a number that we put. No, you don't. Even if you exercise 20 minutes a day, but you need to be consistent. Consistency is the key word here. It's not about exercising 1.5 hours every day. It's about being exercising, even if it's just 3 or 4 times a week, and for anywhere between 30 to 40 minutes a day is great. I think what people need to do is actually watch their nutrition, eat clean foods, eat less processed food. And like Doc said, I don't want to get into the whole supplement debate, but more often than not, if you're a recreational exerciser who's not really stressing the body, food should be enough. Good quality protein, lean proteins coming from your diet. Anyway, bioavailability is much better with food than with supplements, because that's how the body is designed to absorb nutrients. So it's better to get all the vitamins and nutrients that you can from food. But having said that, if you're somebody who is exposing themselves in an exercise environment where you're trying to extract a lot more from your body and you're not making that 1 gram per kilogram of body weight of protein, then yes, you need to supplement, because if you do not supplement, then you're doing more harm than good, because you're not really giving any fuel to your body. But then I would say what Doc is saying, you need to be very careful of what you've been prescribed. If you do not want to go into the synthetic proteins, you can easily go for a vegan protein or a natural protein, or simply just make bone broth, or simply just make whey ghar ka banawa, because you don't need that amount of protein, which is, one is recommended daily allowance of protein, and one is optimal daily allowance. So as a recreational athlete, you need to work at the optimal levels of what your body needs in terms of vitamins and minerals and nutrients. So now that could be different for everybody. And yes, at that point, somebody needs a protein shake, or somebody needs a pre-workout, or BCAAs, or L-glutamine, all that support preservation of the muscle and support the exercise. But again, like Doc said, it needs to be something that you need to have a very trained professional prescribe you, and you need to get it from a very authentic source. So that I think most of the problem is the way that they're coming adulterated.
So shakes replacing, these fancy shakes, the protein shakes and different kind of shakes replacing a meal, yes or no? Quick answer.
Not at all. Protein
No,
is
not
supplement. Not at all. Protein shake is a supplement. It's a supplement to a nutrition program, because you're trying to achieve
a supplement
a
to your
diet.
diet.
Yes.
Yeah.
Not at all. Not a replacement. It's a supplement.
So Dr. Rao, my final question with you now. What is it that people can look out for? Any kind of symptoms, that they
Yes.
can just let's go through that very quickly, so that people, who are, even when they're exercising, if they suddenly feel uncomfortable and they need help, they can immediately, help in time saves a life, I guess.
Yeah. So first of all, is the most common is obviously chest pain, but a sudden amount of crushing pain, pain in the chest, burning sensation, sudden too much of exhaustion after you have done little bit of exercising, jaw pain, neck pain, sudden pain in back. These all can be misnomers of having an angina or having a heart attack during exercise. Now, if someone gets an arrhythmia, his blood pressure might fluctuate. So something like what happened to Saurav Ganguly, he just felt dizzy. That was his only complaint, that when he had a heart attack and when he went to a doctor, found out that he had coronary artery blockages. So you need to watch yourself. Everyone is going to have perspiration and palpitation at the end of exercise. But while you're doing that particular exercise, while you're putting that particular set, okay, if you realize that you have pumping feeling in the heart, sudden onset chest pain, your heart rate is jumping to around 200, you get that feeling because everyone knows how much you can tolerate, how much is a normal increase in heart rate after exercise, how much is a normal perspiration. So excessive perspiration, dizziness, chest pain, sudden onset shortness of breath, which is not regular, like rapid breathing during exercise is common, but you have a rapid shallow breathing where you can't breathe, you have a suffocation feeling while you are doing exercise. This is definitely abnormal. So people need to watch for whether I'm getting too exhausted, I'm perspiring out of proportion to the amount of exercise I'm putting, I'm having too much of an increase in heart rate or palpitation than the effort that I'm putting for exercise, whether I'm having chest pain, having shortness of breath, dizziness, blackout. And something that is very unusual during the exercise is these people have sudden cardiac death and collapse. So it's always advisable to have an AED or a ventricular defibrillator in every gym, which is obviously not, and that is why
I will do that.
Sumaya just got her tip.
That I have at least 10 people whom I know have died in gymnasium because there was no AED available. In Western countries, there are always AEDs available. That if someone, what happens is they get dehydrated, they get exhausted, there is significant pain, and all these three trigger something called as atrial fibrillation, which gets converted into fast ventricular rate and ventricular fibrillation. So if you have an AED at hand, you shock them, give CPR, you can survive those lives. But everyone needs to know all this can happen when they are putting their life at risk, when you are doing too much of exercise training.
Right.
So it's worth, if you're feeling something unusual, just stop there, find out why this is happening, and then proceed to your next exercise regime. Don't just keep continuing when you are symptomatic for something else, because this is what happened with few of my friends who lost their life. Is they had chest pain, but they thought I'll finish off another 10 minutes of exercise and then go and see the doctor, but they could not have an opportunity to go and see the doctor.
And similarly, the friend of mine who I lost while he was running, his wife did tell me that 3 days prior to his death, he was feeling very tired, very fatigued.
Yes.
And they discussed it. And, he went in there, he played an hour and a half of tennis. And then after that, he was feeling very uncomfortable.
And then he went for a run.
And then he went for a run. He said that I will go for a run because it'll make me feel better, And she said, I wish I had stopped him because he was already giving me signals for 3 days that he was feeling not like himself. He was feeling very exhausted and very, very tired. So, doc, is very important. Like I said, we have all our lives to exercise, but there's no point losing a life on exercise. It's really not
tragic.
Worth it.
It's totally tragic. Totally tragic.
I mean, I couldn't have, I know you and I talk about the same person, but I couldn't have known anybody healthier, anybody more disciplined, anybody more focused, anybody more respectful towards his body. And it's so unfortunate that this happened to him,
No, it really is. And I think what both Sumaya and Doc are saying, please read the signs, don't ignore the signs. And, even if it's nothing, even if it's acid reflux, it doesn't matter. Just go get it checked out.
Yeah.
I mean, what harm can it do, right? Just a checkup.
Yeah.
But you know your body best. And in that fad and in that obsession that we in our 40s are going through, step back and think, I mean, where is it taking us? Why are we so into running the marathons? Are we capable of running those marathons? Are we capable of jumping from A to Z in no time? Take your time, take your baby steps, and people like Sumaya are there to help us go through all this. And Dr. Bhalerao is there to keep giving us the tips and instructing us and advising us. Thank you both very much. This is a session that has gone way beyond any sessions I've done, but it's been fascinating and the information has been brilliant, and I think it was well worth the time. We'll connect with both of you soon. Thank you so much for joining me on Table Talk.
Thank you so much for all your
Thank you very much. Yeah.
And thank you everyone else for joining us. We'll upload this on YouTube as well. You can subscribe to Jyotsna Mohan on YouTube, and you will get the episode there as well. And you can also see it on IGTV in a little while. Thank you both, and thank you everyone. Have a good day.
Thank you.